One way or another, all of us have been affected by the COVID pandemic.
Sorry, we haven't paid ourselves since June, and I never thought I'd collect unemployment. We're collecting unemployment.
One moment. Sorry. You may be the last face that someone sees before they're intubated, and they won't see anybody else. They won't see their loved one. It's the nurse. So it's hard.
A new global report from Sapien Labs and the Mental Health Million Project found more people all over the world are feeling the pain related to mental health disorders like depression, PTSD, and anxiety.
I'm willing to try anything just to feel like me again.
The percentage of respondents with clinical level risk increased from 14% in 2019 to 26% in 2020. Researchers broke it down by age group, and this problem was worse among people 18 to 24 years old. 44% of young adults were at risk of a clinical mental health diagnosis.
And that's a huge, huge fraction, because you can't have a situation where almost half your population is struggling.
The big question remains, will that change over time? Some help is coming from the federal government. The newly passed COVID relief bill allocates billions towards mental health, including $3.5 billion for block grants addressing mental health and substance use disorders, $100 million for behavioral health workforce education and training, and $80 million towards pediatric mental health services. Mental health experts that we spoke with say that this pandemic has really lowered the stigma about mental wellness, and that could be a huge help. Mental health care providers right now can't keep up with the large demand of patients, and while on one side that's obviously very troubling, they also say it's promising because it means more people are open to getting care they need.
We've been having more conversations about mental health, but also just the importance of making sure that you maintain a healthy lifestyle to prevent you from getting to some sort of more severe psychological disorders.
I am better equipped now to deal with my anxiety disorder. I hope, if nothing else, that this pandemic inspires and encourages people to not only be more open about their mental health, but keep themselves open to hearing more about others' mental health.
The saying goes, misery loves company. But with a pandemic, so much of that is already shared. That company could be the thing to help heal. Lindsay Thies, Newsy, San Francisco.